Asbestosis and the pneumoconioses. Etiology and pathology. The pneumoconioses are occupational lung diseases caused by inhalation of a variety of industrial dusts. Strictly speaking, asbestosis is a subtype of the pneumoconioses, but, because of its relative prevalence, it tends to be considered separately. Likewise, coal workers' pneumoconiosis, CWP, merits its own discussion. CWP aside, the pneumoconioses can be divided into two subgroups, further details in Table 30. Benign forms tend to be asymptomatic. They can be recognized by the CXR appearances that they produce, small round opacities caused by perivascular collections of dust. Fibrotic forms produce, as the name suggests, pulmonary fibrosis associated with a restrictive lung defect. They may cause symptoms and sometimes progress to respiratory failure. Asbestosis. The interstitial fibrosis produced by asbestos exposure is dose-related, with length and level of exposure relating directly to the development and severity of symptoms. There is often a lag of 20–30 years between exposure and the development of symptoms. The fibrosis tends to be in the lower lobes and is frequently associated with pleural thickening and the appearance of pleural plaques on CXR. Asbestos exposure can also lead to mesothelioma and lung cancer, particularly adenocarcinoma. Coal workers' pneumoconiosis. CWP is seen in workers exposed to coal dust and accounts for 90% of pneumoconiosis claims for industrial compensation that are not related to asbestos exposure. The condition is generally divided into two groups. Simple CWP, based on the CXR appearances of small round opacities that represent small fibrous nodules in the lung, predominantly in the upper lobes. Complicated CWP, progressive massive fibrosis, PMF. A patient is said to have advanced to PMF when these fibrous lesions have reached more than 3 cm in diameter. Histologically, these larger lesions commonly undergo necrosis and cavitation. CWP associated with rheumatoid arthritis is known as Kaplan syndrome. It is also worth noting that silicosis can also progress to PMF, and has also been associated with rheumatoid arthritis. Clinical presentation. This may include breathlessness, cough, jet black sputum production, CWP only. Physical signs. There will be few in the early stages of the disease, but later the patient may exhibit decreased chest expansion, inspiratory crackles, wheeze, in CWP, clubbing, asbestosis, but not silicosis, rarely in CWP. Investigations. Chest radiograph. The International Labour Office has produced a method of classification for the radiographic changes seen in pneumoconiosis. These classifications are largely based on the size and number of opacities seen on the CXR and are used by medical panels when discussing compensation claims. For benign pneumoconiosis, small round opacities are diagnostic of the disease. Asbestos can produce a number of changes, including pleural thickening, pleural, holly leaf, plagues, fibrosis, and evidence of tumors, Fig 23. Silicosis produces classical eggshell calcification around the hilar lymph nodes, as well as peripheral nodules. Lung function tests. These show a restrictive picture with decreased forced vital capacity, total lung capacity, residual volume, and gas transfer. High-resolution CT scan prone and supine films will help reveal the extent of the disease, and are particularly helpful when extensive pleural disease masks the lung parenchyma, Fig 23. Treatment. A priority is avoidance of further dust exposure. The employers of the patient should, if necessary, consider a review of the protective equipment used by their other employees in the workplace. The benign pneumoconioses require no other treatment. Fibrotic disease is normally considered resistant to therapy, except berylliosis, where high-dose prednisolone can produce clinical improvement. Occasionally, courses of steroids are tried in patients with asbestosis who are showing rapid deterioration of lung function. Treatment of CWP is largely supportive. Complications. These may include respiratory failure, right heart failure, tuberculosis in silicosis. Compensation. Through the Industrial Injuries Scheme, workers in the UK can claim compensation for the following diseases: mesothelioma, pneumoconiosis, including CWP, silicosis, and asbestosis, diffuse pleural thickening, primary carcinoma of the lung, only if accompanied by asbestosis or diffuse pleural thickening, and byssinosis. Potential claimants should be advised to contact their local Citizens Advice Bureau when a diagnosis is made.